Welcome, everyone. This session is about suctioning techniques, specifically for patients who are not on ventilators but still need help clearing secretions. We'll focus on how to suction safely and effectively using suction machines. This is a basic but essential skill that helps improve breathing, prevent infection, and support patient comfort. The accumulation of excessive airway secretions can obstruct airflow, impair gas exchange, and cause patients to experience a sensation similar to drowning, a clinical presentation often observed in patients with ineffective cough or reduced consciousness. During suctioning, your hands may come into contact with secretions, so gloves are essential. The procedure often triggers the patient's cough reflex, increasing the risk of droplets or splashes. To protect yourself, always wear a mask, and if available, use goggles or a face shield for added protection. When you suction, always keep things sterile to avoid infection. Wash your hands before and after. Use sterile gloves and single-use catheters. Don't let the tip of the catheter touch anything dirty. Remember, suctioning goes inside the body, it's an invasive procedure, so treat it seriously. Before suctioning, always verify the pressure setting and use intermittent suction to minimize airway trauma. Recommended suction pressures are: adults, 100 to 120 mm of mercury, children, 80 to 100 mm of mercury, infants, 60 to 80 mm of mercury. Excessive pressure can injure the airway mucosa or cause bleeding, so always double-check the settings before you begin. Nasal suctioning is often more effective because it can go deeper into the airway. The shape of the nose and throat helps guide the tube closer to where the secretions are. That means it can clear mucus better than oral suctioning in many cases. The nasal passage follows the natural shape of the airway, so when we suction through the nose, it goes straight down to the back of the throat, that's the nasopharynx and oropharynx. This makes it easier to reach deeper mucus and clear secretions more effectively. Oral suctioning often causes more discomfort because it touches the tongue and throat, which can trigger a gag reflex and make patients feel like vomiting. That's why awake patients usually don't tolerate oral suctioning well. The nasal route avoids these areas and feels less irritating. The nasal route gives better control when inserting the catheter. It fits the shape of the nasal passage more naturally, so it's easier to guide. If done the right way, it also has less chance of causing injury. That makes suctioning smoother and safer. Use nasal suctioning as the first-line approach unless the patient has conditions such as a basilar skull fracture, nasal bleeding, facial trauma, or nasal obstruction. A basilar skull fracture is a strict contraindication for nasal suctioning due to the potential risk of intracranial catheter insertion. Always closely monitor the patient during suctioning. Watch for warning signs such as a drop in SpO2, bradycardia, or increased respiratory distress. This session we talk about how to perform safe and effective suctioning. We focused on why nasal suctioning is often more effective, how to choose the right pressure aseptic technique to prevent infection, watching the patient's response during suctioning. Always treat suctioning as an invasive procedure, do it with care and confidence. Enjoyed the video? Give it a like and share it with your fellow nurses. We'll keep bringing you more useful nursing knowledge and support.